Wonderful. Well, for our networking lunch, we're very excited. This is a hybrid conference and a hybrid panel at our hybrid conference. So I'm very excited to see how this works. So we have four wonderful panelists here today for our getting practical advice for getting funded in pragmatic research. And I'll briefly introduce them and then turn it over for some discussion around how do we all get funded in pragmatic research. First, Dr. Jody Summers-Holtrip is a professor and vice chair for research in the University of Colorado Department of Family Medicine, an associate director and senior implementation scientist with the Adult and Child Center for Outcomes Research and Delivery Science, CORDS, here at the University of Colorado in the School of Medicine. She's also a senior scientific advisor, or was, for the Agency for Healthcare Research and Quality for dissemination and implementation science and primary care research. Dr. Amy Hupschman, her research is on optimizing the delivery of evidence-based interventions to improve the treatment and prevention of diabetes, asthma, cancer, and other chronic diseases in randomized controlled trials, and to adapt those interventions to be feasible for delivery in real-world primary care and community-based settings. She's a primary care physician and associate professor at the University of Colorado School of Medicine with the Division of General Internal Medicine. She's also an implementation scientist here in CORDS and the lead scientist for community education and outreach for the Ludemans Family Center for Women's Health Research. She is an implementation scientist for several NIH-funded pragmatic trials, including serving as multiple PI for one of the 7 NHLBI-funded Decipher UG3 UH3 awards to leverage implementation science to improve cardiopulmonary health inequities. Dr. Dan Matlock is the director for the Colorado Program for Patient-Centered Decisions at CORDS. He's board certified in internal medicine, geriatrics, and palliative care. And his research is aimed at fundamentally changing and improving how patients make decisions around invasive interventions. And Dr. Spiro Manson, who's Pembina Chippewa, is a distinguished professor of public health and psychiatry, directs the Centers for American Indian and Alaska Native Health, Cheyenne, and occupies the Colorado Trust Chair in American Indian Health within the Colorado School of Public Health at the University of Colorado Anschutz Medical Campus. His programs include 10 national centers, which pursue research, program development, training, and collaboration with 225 Native communities, spanning rural, reservation, urban, and village settings across the country. A medical anthropologist, Dr. Manson has acquired $268 million in sponsored research to support this work and published 280 articles plus on the assessment, epidemiology, treatment, and prevention of physical, alcohol, drug, as well as mental health problems over the developmental lifespan of Native people. His numerous awards include the APHA Remo Lapus Mental Health Epidemiology Award in 1998, an award for lifetime contribution to the field of mental health in 2019, 4 special recognition awards from the Indian Health Service, 2 Distinguished Mentor Awards, the AAMC's Nickens Award, the George Foster Award for Excellence, and many more awards. He is widely acknowledged as one of the nation's leading authorities in regard to Indian and Native health. And we've invited our colleagues here today to talk about getting funded in pragmatic research, which we defined as research conducted in and designed to impact real-world communities, to address health inequity, and to make sure that the interventions, that the treatments and programs that we're developing and testing can impact outcomes that really matter to those who stand to benefit and those who stand to be harmed. So with that, I'm going to turn it over to our panel to talk about how they would recommend you go about being as successful as they have in this world.
Hello, everyone in the room and online. Jordan put a request in the chat to please submit any questions that you have for us as panelists. And I put in a few different online resources, those of you on Zoom could click on and take a look at. And I'm happy to take a tour of those if needed, but I thought that, as Bethany said, we might also see if each of us wants to just give a comment, any introductory comments while we're waiting on any questions in the chat.
Yeah, we talked about creating, I have a I have a mic. Can everyone hear me? Okay, so we talked about creating a slideshow and then we looked at the title, which was networking lunch. So we wanted this to be interactive and really focus mostly on your questions. So we can just kind of talk, but it might be better just to take the questions and do that. I'm just gonna kind of pick on Dr. Manson. Wow, that's like a lot of funding. So maybe, how did you get to all that funding? Like, do you have a few things you want to start with while we're waiting for some questions?
Oh, I'd be glad to share a couple of things. Certainly I'll be briefer than the introduction, which is a little bit embarrassing. I apologize for that. First off, I'm a firm believer that successful grantsmanship is a teachable and learnable skill. I think anybody can accomplish the goals and objectives in terms of securing externally sponsored research. I've had the privilege of 30 years now directing a major research career development program that attests to that. There are, I think, a variety of skills that sort into at least 3 different categories. I don't think it's by accident that these categories reflect different notions of support. There is first informational support, knowing where the money is, who provides it, what their priorities are, and of course, how those priorities align with your own and the key stakeholders with whom you work and the nature of science that you propose to pursue. The second is affective support. This is an example of that. And the ability, not only in terms of senior junior mentorship, but near as well as peer mentorship, of coming together to share the lessons learned and developing a thicker skin to constructive criticism, to hone the instrumental skills that are necessary in this regard, and being able to surmount and translate, if you will, those situations of threat into seeing them as opportunities as well as for success. And the last is the instrumental support itself, the actual skills, the mechanics, the understanding of the nature of grant applications, their format, and the presentation marketing of those, as well as the clarity and persuasiveness of your writing in terms of seeking that support. And ultimately, being a medical anthropologist, I'm deeply into developing internal champions. One is surprised at the extent to which grant program officials across all the ICs at the National Institutes of Health, for example, but this is true in other sponsors, as in my experience, is that you can reach out to them. They're highly accessible. In fact, among the rewards that they see in terms of the nature of their work is they enjoy interaction with us externally and out in the field. They get a great deal of satisfaction of being able to understand, support, and promote the nature of our work and investigators, young and old. And they are our greatest allies. So I think that those 3 areas, instrumental, affective, as well as informational approaches to this endeavor, are cross-cut by developing those kinds of relationships with the people who are closest to the sponsors themselves. So those are my experiences of the keys to success.
What did you call the middle one? You said informational and the last one was instrumental. What was the middle one? What was the last?
Affective, just having support about, I mean, like the probability of being rejected or not discussed on your first submission is much higher than being funded. And, one needs help thinking through both the emotional, psychological, as well as the other aspects of rejection and how to turn that rejection into a challenge and an opportunity to respond to. So that affective support is really, really important from my point of view.
We're lacking questions. Any follow-up on Dr. Manson? Okay, go ahead, Dan.
I was just going to jump in if somebody didn't have a question. I really like that 3-peer model of grant writing, and you talk about the word persuasiveness, and I think that's one of the areas where I think a lot of people struggle because we're scientists, and I love writing grants. I think it's kind of fun to see if you can put 12 pages down and see if they'll give you $2.5 million. There's a little game there, but it's also it's that persuasive piece that's fun. And then when I shift to writing papers, it's actually a much harder task for me because you're supposed to be that objective scientist and not trying to persuade too much when you're presenting your results. You can talk about that's not a clear dichotomy, and we all have our incoming biases. But I think when you talk about pragmatic research, it's really that sales. You really have to sell to the panel why a more pragmatic design is better than a more reductionist scientific design that people are more comfortable with. And then it gets into knowing the panel, and is this going to be a panel of more clinician scientists or scientists who want to see the type of science that is more reductionist, and then thinking about how you sell, how far you go down the road to pragmatism. In contrast, you could be working with a foundation or PCORI that is all about the pragmatism and is less about the science. And it's really a function of getting to know who those people are. Because if it is sales, then all sales is about the audience and getting to know your audience. And your audience is just a handful of people. And if they're like me, they're drinking a beer at 10 o'clock at night reading your grant. And so, that's and so figuring out how pragmatic they're going to let you be is I think probably a really important piece, and seems to be one we debate a lot, like, oh, this panel just didn't get it, or this panel, try this panel. It's just it never surprises me how important that aspect is really knowing that review audience.
I was just going to follow up with that. To me, there's what does it take to get any grant funded? And then there's what does it take to get a pragmatic research or a dissemination implementation type of research grant funded, because it's a certain kind of application. And my in particular two main advice for any grant is that at the end of the day, number one, you have to like the idea. It has to be an idea worth doing. So that's the significance of it. Like, we want to see this study happen, and it's worth doing. But number two is you are the people to do it. And so you have to, that's where I think Dan was talking about the persuasiveness. Why are you the team to do this? And so one of the main things that I see in applications that I review is just not enough detail around what it is that you're proposing doing. And so the reviewer is left with not feeling convinced that you're the right person to do it, or that you can do it. So you have to prove the feasibility of, yes, we really can get that EMR data. Yes, we really can analyze that data. Yes, we can really answer these questions. And so that's a really important part of that. In terms of specific to pragmatic research, it is different. I don't think it's better or worse, but it's different. And so if you are going to a study section that has a bunch of implementation scientists in it, they're going to be looking for certain language. They're going to be looking for a certain kind of approach. And it is different. So those are the things I'm not going to go through all those things, but I mean, one of them, it's a kind of a key hallmark, is if you're taking an evidence-based intervention and you're trying it in the quote real world, why are we asking for millions of dollars to fund that? Because once that intervention, because once the money comes away, we just had a talk by Dr. Coots on that, but like once the funding is going away, that's not sustainable. So asking for money to actually do the intervention is kind of a no-no in many instances. So that's one area where I think it's kind of different than a regular study. I don't know what you call it, traditional non-pragmatic study. So.
Really good points, Jody. And to that, I put in an ebook link in the chat that articulates 10 key ingredients for D&I proposals, including frameworks to use and things along that line that Anola Proctor and colleagues published on. We made that into an ebook, as well as Ross Bronson's tips section by section for NIH proposals to address those types of points. But I think Jody articulated that very well and succinctly. We're now getting some networking potential, some
Yay,
questions in the chat and comments. Maybe while I'm talking, there is one question from Heather that I'll see if I can address quickly. Otherwise, I think we could go in order, starting with the one Bethany posed.
Sounds good.
So Heather is asking if there are examples of successfully funded grants across the variety of grant mechanisms, different funding agencies. And the one that I put in from reaim.org does include, I believe, at least one VA proposal as well as an NIH proposal. So there are, I'll repost that reaim one here in just a moment. And then the one I put in from UNC, our UNC colleagues also has a diversity of proposals there. NCI also has some different ones on their
I was going to say
website.
NCI
I can
has
look
a
for
bunch of examples.
Yeah,
Yeah, if you go
I'll
to
look for that to
National
put it
Cancer
into.
Institute. Yeah. Do you want to start with Bethany and
Yeah,
direct
let's
the
go.
questions? Go ahead. You want to go ahead? You want me to?
You go for it. Jen.
Okay. So starting up at 12:31 p.m., we have a question from Bethany around. I'm sure to have been as successful as you are, Spiro, Dr. Manson has been. He has had plenty of not discussed. So that means it didn't get even to the group where it's talked about and scored. So that's kind of what they also call that triaged here in the US. You don't even, you know you're not getting funded. How do you repackage or respond to reviews that don't result in funding? So whether they're not discussed or just not funded, how would you answer that?
Well, that's a wonderful question. It goes back to my point about turning threats into opportunities and challenges and not being dissuaded by not being funded or not discussed. I will confess, out of 115 applications, I've had 96 funded over the 45 years of my career. I recently got my first and only to date not discussed application. And it was really interesting. And so the first thing you have to do is step back, not personalize it, and then do an autopsy. And for example, if you haven't looked at the membership of the study section and carefully assessed what their areas of expertise are, that's a potentially fatal flaw. Especially wasn't the case this time, but especially in the application, you indicate that something's ever been done and a member of that study section has actually published about it. Another thing that I think that increases the other thing is our career development programs. The very first day of orientation, I hand out an application form to Gamblers Anonymous. I believe that there's a very healthy element of gambling to this process. And I adopt the view that what we're trying to do is increase the probability of success, because there are no guarantees, because the section that you're assigned to, the reviewers, the time of day, the order in which your application is reviewed are all very random factors you have no control of that do in fact impact the assessment of your work ultimately, and whether it's how well it's regarded. But it's altering that into, those threats into challenges and opportunities. I'll never forget, for example, one of the very early manuscripts I submitted. I was very proud of it. And I think manuscripts reflect some of this. And I submitted it to a high impact journal, and I got 2 great out of 3 reviews back. But the third reviewer began his comments in the following fashion. Having read the abstract and the introductory paragraph, I was anticipating a glass of fine red wine and looking forward to this. However, by the time I finished, I felt as if I had been served a mason jar full of lukewarm dishwater, and then he trashed it and it didn't get funded. Now, I could have just put that away. And I think all of us have probably at some time in our careers have gotten something like that, perhaps not as baldly as one of my first. But I took it as an opportunity to challenge. And so it's the cognitive reframing of how to approach this. And there are all kinds of mechanics, many of the resources that Amy was describing, that we can access to figure out how to reframe and retool these applications. And so, I think the hardest thing is to get over initially rejection and to face it and to persevere. That's my best advice.
Thank you for sharing that story. That, yeah,
From red wine to dishwater.
yes, yes. We have a question in
I can
person
share.
here, so.
I'll shout and then maybe.
Okay,
just
I'll
relay
repeat
yeah.
it. Try.
So in Australia, our national funding schemes don't have a not discussed. They will
Okay.
always get something. But so we'll do a similar thing, repackage, try a different scheme, it goes on. How do you know when you just think this grant we need to stop, really go away, and call it, or let's keep going, try something else. And when do you call it on a project and not keep submitting it?
This is a great question. So this is a participant from Australia. They don't have a not discussed category, but check me if I have this right. When do you know when to stop? You can keep resubmitting. So when do you know, okay, this isn't going anywhere? Anybody want to take that?
No.
I mean, that's a hard question. It's very much sort of an emotional question in a lot of ways. I mean, if you believe that this is the work that needs to be done and it just didn't sell well, then maybe you didn't have the right funder and you need to keep pushing it. You got to listen to that internal voice that's driving whatever passion you have. If you submitted a grant to, say, the NIH and it looks like their comments really just aren't addressable, then you're probably done with that grant at that avenue. But I've seen not discussed go to like a score of 12 in the next submission. So that, there's this dogma out there that, oh, if it wasn't discussed, you don't have a chance of getting it on a resubmission. I think that's baloney. I think it really depends on what they were concerned about. And if you can address those concerns or not. I think that's the biggest thing. The couple grants that we haven't resubmitted yet are ones where we really don't know how to address the concerns. And those might die on the vine. We've all been a little busy the last couple of years, so we haven't been able to push as many things forward. But I think it's a hard question. But if you really, really care about something, then you should try to keep pushing it.
I'm just gonna add one thing to that, and then we have another question in the room, but also some on chat. So maybe we'll go back and forth between in the room on chat.
Okay.
The quick additional comment is if the actual RFA had a fundamental aspect of what those critiques from the study section are then unaddressable, it's different than just thinking, do I seek to go elsewhere in this institute, or I think there's just some nuance there, and speaks to also Spiro's point about what is the composition of the study section, the things they care about. Am I going to just never change their mind about this type of thing?
I just want to add one really quick. It's good to be persistent. You got to keep trying. I haven't gotten many grants. I've gotten some funded the first time, but oftentimes it takes 2 tries or 3 tries. But if they really, really don't like your idea and it's not kind of pragmatic stuff that you can fix, then you have to go somewhere else or pivot a little, maybe within the same realm, something like that. Where did you want to go next?
I'm a big believer in that old real estate saw about location. I think in the grantsmanship world, it's about efficiency. If a grant just doesn't fly in its current form, are there elements of it that you can extract, build upon it, and carry through that are still consistent with what you'd like to do? I don't see anything. Let's fail forward and take the lessons away from those failures that may lead us in related but slightly different directions that have a greater probability of funding. So.
Okay, so I'll read here Lauren's. We're going to try to go in order in the chat and then also alternate in the room. Lauren had put, what are some ways to increase innovation in pragmatic trials applications? And I'm reading it out loud, though I don't think I have I think this can be a tough one for pragmatic trials sometimes because it's, I'll just reflect from my own experience. We're trying to take things that are real world and do them in real world settings. And sometimes the innovation piece is one for pragmatic grants where it's not quite as, this new innovative thing because you're actually trying to get things that are evidence-based to go. Sometimes you're leveraging information technology for that, the efficiency of information technology. I've certainly seen that be the case. Do others on the panel want to comment or anyone want to put things in the chat?
Yeah, I'm dealing with that right now, actually, with my RO1 resubmission. It was to the implementation science NIH panel. It was not discussed. I am not Spiromance, and I've already had more than one, and not discussed. But one of the comments was that I don't see, it was a very pragmatic trial, but the comment was, I don't see how this really advances the field of implementation science. And that's where having a team of sort of getting more into the D&I and thinking, well, what's really innovative here? And I'm adding an aim around adaptations, which is an area of innovation in implementation science and fits with our project very nicely, but I didn't have it in there in the first submission. And that's going to be how I respond to that comment that we weren't innovative enough. So, I mean, I think within the field of pragmatic research, there's lots of ways to innovate. You know, we just saw talk on sustainability and or talks yesterday on equity. Actually, you know, a lot of the talks this CopperCon have been very high yield in terms of where is the cutting edge in implementation science. And so I think just highlighting that, Lauren, kind of in that innovation section, whatever that is where you're pushing the field of implementation science, I think is one way. Because I do think just being pragmatic is not innovative enough anymore, which is good. It means we're kind of pushing the needle towards more pragmatic research.
You know, one of the curious disconnects, Amy and Dan, is that when we look at the reviews that the Center for Scientific Review has done about the various sections of grant applications that contribute to the overall impact score, the innovation section actually doesn't contribute much. It's the methods and approach section and the specific aim section, right? So, but there is this disconnect because many of the comments we'll get back from a study section have elements of innovation, just as you were described, as a part of the critique. And I find the innovation section is one of the most difficult sections to write in a meaningful fashion that will likely impact the score. So, you know, I think that's one of the biggest areas of attention that we can give. So I think elements of cost and cost savings, because as we know, the stories about benefit to individuals and communities are necessary but not sufficient these days. The ability for uptake and adoption by an increasingly larger number of organizational sessions. That's one possibility. Another is the integration of different investigative methods, whether it be qualitative and quantitative, these kinds of things. But I still think ultimately when we're in a search to try and understand what contribution that innovation section makes to the overall impact score that we receive in our applications.
Great point. I think the question that was in the room, Jordan went ahead and put in the chat for us, which is, do you submit to different funders at the same time or do you take it one at a time? This speaks to Spiro's Gamblers Anonymous and raising our probability comment earlier, I think. Anyone want to take that one? And I'll just say, at least administratively, right, we can't submit to NIH and AHRQ simultaneously. They're both federal funders, so that has to be just sort of administratively sought out, or can't do to one institute in NIH or one IRFA and then another one. So that, of course, being just like the feasibility issue, can't do that. I've certainly thought myself about things to shop to PCORI at the same time as a federal funder. Wonder if anyone else wants to comment there.
I was just going to say, you can be tricky and you can say, I want to study this particular intervention. So one time I submitted to NHLBI, which is heart, lung, blood, and NIDDK, which is diabetes, digestive kidney disease at the same time. It was essentially the same intervention. One was targeted at looking at diabetes outcomes and one was looking at heart disease outcomes. And it was essentially the same thing. And we could, if both were funded, we could have done both. So that's one way you can legitimately do that. We ended up getting the NIDDK one. And so we told NHLBI no, because we just didn't feel like we had the resources, but we could have done that. But you're not supposed to apply for the exact same thing at more than one federal agency. I guess you could apply maybe somewhere else, but I guess what I would say is try to figure out how it's different enough that you could do both if both were funded. So that's my quick answer. Anyone else?
Well, I think underlying this question is the importance of diversifying your portfolio sponsorship. one of the biggest challenges we have is many of us in diabetes work or CVD or mental health, we tend to go to the institutes that sponsor that work. But as you suggested, Jody, there are other institutes that are equally interested in different dimensions to the same sets of research questions. And so what one's doing, and it depends, of course, on bandwidth and the collaborative groups that you're part of, but you're diversifying your portfolio. So you're not held hostage to a given set of priorities at a particular point in time. And that's really important in terms of being able to establish a stable funding base that allows you to build your research enterprise and advance it.
Great points.
Do you want to go to a chat?
Yeah, I
question?
think Arthur's question was next up in the chat, which was, can you talk about the ways you develop and maintain community partnerships?
That's a big question. I can talk really briefly. A lot of the work I do is with implementing in inpatient settings with cardiologists, doing major interventions. And, you know, you might initially think, oh, there's not really a community there. But, you know, I have learned the importance of being really empathetic to the cardiologists and their pressures and the staff and their pressures. And I'm going to go and try and get them to use this new education tool or decision aid for patients. There's going to be a lot of pushback and, you know, 10 or 15 years of conversations and talking and learning and a lot of empathy to whatever their perspectives are. As I talk to people who've done a lot more real community engaged research, I've realized that a lot of the methods are similar, even if it's not nearly as challenging or robust. It's still the same principle of a lot of empathy towards what they're going through.
I'll just comment briefly as well. Arthur's part of the group that we're doing this school-based asthma program with, so he already knows one piece of this that I'll say, but we have trying to scale up this school-based asthma management program that also addresses social determinants of health management across 5 regions of Colorado. So we have 5 regional community advisory boards, as well as 1 state advisory board where there's an interchange between each of those 5 communities. And it's been really exciting to see them make bonds with one another in the state advisory board and feel part of this fuller expansion across the state. The other group I've been working with over the last decade is the Center for African American Health here in town, where we did a community-based participatory research project together about scaling up the physical activity guidelines for Americans in 2009. And that work has led to us continuing to support their community health efforts with an annual health fair where they've needed help staffing a women's health screening area. It's allowed us to continue that partnership. And then in the COVID-19 pandemic, I connected them with one of the groups nationally that was seeking to do listening sessions with local communities of color. And they really appreciated that and then started doing COVID-19 vaccine sessions for their community at the Center for African American Health. So that's just one story. It hasn't always been research that we've been doing together, but it's been a lasting relationship where we can continue to turn to one another when the time is right.
Do we want to go to the next question in chat?
I think so. Mike keeps noting our time, so we have 6 minutes
have
left.
6 minutes, so we have how
You
many?
see one there?
Well, I'm just going in order. Laura, in the clinical research context, can you describe how to differentiate between QI and pragmatic research in your grant proposals and in your IRB application? Anyone want to take that one? Dan, you.
I mean, I can always talk if, but yeah, I think IRB is a totally separate question, and convincing them what is research and what is QI is totally separate from convincing a funder. I think the funder question in many ways is easier. I think it goes back to what about your pragmatic project is potentially generalizable? What are you doing that's systematic? And if you're systematically collecting data with the interest of trying to develop generalizable knowledge, then that's research. And you can do that in a very pragmatic way, even using that very strict definition of research. And it's just highlighting, using a framework instead of just going in and doing something. And then reporting your results using that framework is already elevating your work above just a simple QI, in my opinion. Now IRBs, it's much harder to convince them of those kinds of things. And I've just kind of resigned that sometimes let it be a QI project in the IRB's mind, publish it as a QI project. And then it'll still have the same amount of impact that I want to have in terms of changing healthcare. But I do think when you're writing the grant, there's a lot of things you can do that raise it above QI.
Part of that is how you sell it when you write the application, in the sense that if it feels like a research should be rigorous in terms of the research you're conducting. And so, you use rigorous designs to the extent you can, and multiple methods, and, all the things that you want to do a successful research project. It's going to read like that when the reviewers read it. It's going to have that research feel to it versus the methods for quality improvement are different, PDSA cycles and things like that, so it's gonna read and feel differently if it's a research project. So I don't know if I can explain that better, but
Well, like the person in one of the last sessions who was talking about the realist reviews or doing a realist review, you could do a project and then just report your results, or you could do a project and report your results doing a rigorous realist methodology with context, mechanism, and outcomes. And you've kind of elevated it above being just a single center QI or a single project, because now you've done something that people can grab onto and try to replicate in some way, even if it is still squishy social science. It's, there's ways to elevate it.
yeah, I guess what I was just thinking is my study is very, very pragmatic that I have right now. And it's step, wedge, cluster, randomized, covariate, constrained design with a bunch of methods. It reads really much like research. So those are some of the things that are going to make it seem like research, and how it's going to apply beyond just like what you said, Dr. Matlock. I think we have time maybe for one more question. I think we have one more, right?
We do. I might put Katie's forward for input, because I think it touches on some of these pieces like squishy social science. Or do you think there's a need, Katie puts, to have more input before submitting, including input from, quote, traditional researchers who might also be represented on a study section? What's your approach to getting input before submission?
Do it. Get as many people as you can. You never know what other people are thinking until you give it to them. So I think that's a great idea. Pick out some people who are really gonna actually read it though. Like I give things to Russ before I submit it, and they're just red flying all over the place. And it's great because he's just like, did you think about this? Did you think about that? And that's really, really helpful versus someone who it's like, oh, that looks great. That really doesn't help you. So it feels good for a minute, but you don't want to then submit it to the study section and have them have all the things. So you want to try to, I don't know, I try to pick out 2 or 3 people to really, really review it a lot.
And I think Spiro's unmuted. Do you have a comment there?
Yeah, I'm sorry. I was busy laughing at Dan's comment about squishy social science, because I'm an anthropologist, probably seen by most as the squishiest of all social sciences. And the irony is, and I think Jody was making a strong case for this, there is rigor and scientific merit to all forms of inquiry. It's just incumbent upon us as applicants to be sure that we apply those criteria and communicate them effectively to our audiences. And I think it makes them less squishy. And that's why I was so busy laughing about that. So it was a great question, a great comment.
I think we're up on our time. If anybody has one more, anything?
I think we are at time.
Okay.
Thank you,
so much fun.
everyone.
It's hard to
Appreciate
stop.
you.
Thank you all.
Thanks. Bye.
Thank you.